Hello and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about bladder leakage. This is like a super common thing in pelvic floor therapy, and there's two main categories of bladder leakage. So we differentiate this in the clinic, and we sort of differentiate how we treat it based on this. And you can have one or the other or both. If you're lucky, you get all of the above. I'm kidding. But there's treatments for it. So number one, we call stress urinary incontinence. Bowel incontinence is a whole nother topic. We can talk about that another day. We're talking about bladder leakage. Okay, so stress urinary incontinence is something you leak urine with physical activity, a physical thing that happens. So it's either with exercise, like running, jumping, lifting weights, or with something physical like coughing, sneezing. So basically with stress incontinence, it's the physical stress of something physical happening in the body that's stressing out the bladder. It's too much physical stress for the bladder to like maintain continence, and it leaks. So stress incontinence. Number two is called urge incontinence, and that's like on the way to the toilet, like, oh, I have to go to the bathroom and I have to go now, or I might not make it, and maybe I leak on the way to the toilet or right when I get to the toilet. Also, kind of what falls in this category is what we call key in lock syndrome. So just like it sounds, it's like when you get home and your key is in the door and it's like, I have that sudden urge to go, that falls under urge incontinence. So it's kind of those two things. And some people, lucky enough, have both. And I would say majority of the time it's one or the other. And again, some people have both and we treat them differently. So like the stress incontinence is sometimes pelvic floor muscle weakness. Sometimes it's pelvic floor muscle tightness. So a muscle that's tight, it can't contract anymore to hold anything else. So we gotta usually first work on relaxing the muscle, and then work on strengthening the muscle, and then work on coordination. Sometimes also stress incontinence is we gotta work on something else. So especially if it happens with exercise, I tell people our pelvic floor muscles, they're really small muscles. They're not our major muscle group. So if you're having leakage with exercise, running, jumping, lifting weights, we gotta look at what you're doing with exercise, and we gotta look at the bigger muscles. So sometimes for that, it's your breathing, like if you're holding your breath with lifting heavy weights, that puts pressure down. Sometimes it's your mechanics, like with running, like maybe you have a poor posture, or you're holding your abs in. I tell people, like, don't try to hold a Kegel for the whole time you exercise. That just doesn't work. I don't think there's any muscle we can hold for like 30 minutes straight. We really got to get it to be more coordinated and to turn on when we want and turn off. So what happens normally, like let's take running as an example, every time we step, the pelvic floor muscle contracts so we don't leak urine. And so we got to get it back to do that. It's not on the whole time we're walking. It's on, off, on, off, on, off. And I see this in the clinic. I test it with people and I show them like, oh, you moved your leg, like your pelvic floor muscle turned on. That's what we want. You laughed, your pelvic floor muscle turned on. That's what we want. So we want it to be automatic again. I'm never training people to like hold a Kegel the whole time they run. Like that's just impossible. So if it happens with exercise, then we got to look at some other bigger muscles and your technique and your form and things like that. And to me, I really love working with that because it's sort of like the two worlds of pelvic floor therapy and sports therapy together, and we get to do both. So in the clinic, when I see those people, I assess their pelvic floor muscles for all the pelvic floor things, strength, tightness, endurance, and then I look at other things like strength, flexibility, like the actual movements, their running pattern, their lifting pattern, jumping, whatever it is. Sometimes with jumping, it's as simple as land quietly, land softly, let your legs absorb the impact. So that's a lot about stress incontinence. With sneezing, I made a whole video, I'll link it below, but sneezing, let your sneeze out. That sometimes is the only thing you need to do. And then urge incontinence is bladder habits. So go watch the video I made for like women over 50 with bladder urgency and frequency. Even if you're not over 50, that will go more in depth. But bladder urgency or urge incontinence is like on the way to the toilet. And that probably comes from bad habits of either going too often, your bladder shrinks, the signal isn't correct, or you've ignored your bladder for too long, for too many years, and you don't get the signal until your bladder's really full. So we gotta retrain that. Like in majority of cases in the clinic, if it's urge incontinence or bladder frequency, I don't really see a lot of pelvic floor dysfunction. It's habits. And so I created this online course because I'm like, I don't really need to see people in the clinic for this. They need to work on their habits. So I'll link also below the link to my free introductory bladder course, and that's really geared towards that. My online bladder course is comprehensive of all. I added in like things about running, jumping, coughing, sneezing, bladder habits, urgency, frequency, not emptying completely. Like I added in all of that to make sure we cover all the things. But originally I created it for urinary urge incontinence or bladder frequency because it majority of the time comes down to habits. So I really love treating these things because it's not just about Kegels, and everyone, you know, sort of the message out there is like, do more Kegels. And so I tell people like, try it. If Kegels help your bladder issue, then great, you solved the problem. But the people I see in the clinic, Kegels weren't the answer. And Kegels usually aren't the complete answer. So I would say what I see clinically is it's a combination of bladder habits, Kegels, and then looking at the other muscles and movements and activities. So it's kind of all those pieces. So Kegels is one piece of the puzzle. It's not the whole picture. So yeah, hope that helps. So 2 types of incontinence: stress incontinence, the physical stress, physical movement; urge incontinence on the way to the toilet.